Hello, I am Dr. Steve Johnson, and I want to welcome you to this short presentation. Actually, I collected questions from YouTube members about REBT, and it was wide open. Any questions that you had, I was willing to take them. So I call this REBT Explain Answers to some of the common questions to REBT. So let's jump in. I have these recorded ones. I just printed them off. And we will see what the questions are. I haven't been able to go over them, so they'll be as new to me as they are to you. The first one is actually a good one. What are the most common therapist mistakes when disputing irrational beliefs? And there's one that just really jumps out to me, and that is often we'll see this with somebody who's new to REBT, the therapist, but sometimes those of us who aren't so new do it too. When we look at the types of unhelpful beliefs, irrational beliefs, some people call them, I prefer unhelpful beliefs, then the technique or the process within REBT is to figure out what the situation is that the individual is going through. Sometimes we call that an activating event, or the most significant part of that activating event is called the critical activating event. And then we find out what beliefs the individual held about that situation or the event that contributes largely to emotions, behaviors, and even physiological responses as a result of those beliefs about the situation. And the next process is disputing those unhelpful beliefs. That's one way. We could also, there are other techniques, but that's a common process, is to dispute them. We don't argue with the client, we dispute unhelpful beliefs. And one of the most common, and actually the core disturbance-producing belief, we call demandingness. And so we will often explain that at least in English, I don't know for other languages, but at least in English, we get a hint that a client is being demanding, or ourselves are being demanding when we hear certain words like should, ought, must, have to, or need. It doesn't mean that those words have to be there, or that when those words are there, that we are being demanding, or we're holding demandingness beliefs. But they are cues, and so if we hear them, we might want to find out whether the client is demanding. But some people become word police. If the client says should, we go, that's demandingness. Maybe not. We have to look at the context and how the client is actually using it. So it is the function of the word, not the word itself. Simply because someone says should doesn't mean that we're being demanding. I might go, you should probably eat right now. It doesn't mean that I absolutely have to, or not holding it as a demand. It might be a good idea. So if we disputed that, we would be disputing something that is not problematical. We would dispute a belief that is not problematical. So I hope that's helpful. The other word that we often say is, oh, that's awful. Well, one kind of category of dysfunctional belief within REBT is awfulizing. That's when we think something is 100% bad. But we say awful all the time. Oh my gosh, this rain is awful. Will it never end? It doesn't mean it's going to negate all meaning, purpose, and potential happiness in life. And so it's just maybe an expressive, evocative use of the word, not really a declaration that we believe that it is truly awful. I hope that's clear. Another question, actually quite good, is if a client understands the ABC model intellectually, but continues to feel intense anxiety, what would you do next? Now, this is going to be really common. ABC model, in case you just don't know what that means in terms of REBT, A stands for activating event, or the situation or the relevant situation or event that the client's going through. B would be the beliefs about that belief in the term of evaluative cognitions. And C would be the emotions, behaviors, and even physiological responses. And we would say that to a large degree, the situation does not cause the emotions and behaviors so much as what we believe about that situation. And so let's say the client learns about the ABC, they kind of grasp it and makes sense to them, but they continue to feel anxiety. Well, that's going to be really common. There's one thing to know the model. It's another thing to have insight into the workings of the model, and there is still another thing about putting that model into practice. Insight is good, but it may not make a change in an individual. And also, if we're not using it to grasp, identify the dysfunctional beliefs and then actually challenge them and replace them, then the anxiety will, of course, still be there. So this is going to be very common, especially early within the therapy. Another one is, what's the difference between emotional acceptance and resignation? I'd probably rephrase that a little bit. Acceptance is a cognitive act, not an emotional act. And so if someone cognitively accepts that something is the reality, that's good. And in REBT, we do want individuals to accept what's going on around them about which they may be disturbed. Acceptance means not it, doesn't mean that we don't want to change it, but we just so acknowledge it is what we mean by acceptance. And if I accept that there is a reality that's going on, maybe I don't like it, maybe I like it, that doesn't mean that I just say, oh, I have to go along with it in a fatalistic way. So I could accept some kind of a reality, but go, you know what? It'd probably be in my interest to act upon some more functional beliefs, etc. So it doesn't mean resignation at all, not in the way that we're using it within REBT. How would you explain unconditional self-acceptance to someone who thinks it means lowering standards? Excellent question. And a lot of people think that if they unconditionally accept themselves, it means that I don't have to have high standards. It doesn't mean that I don't want to change something. It doesn't mean that I'm perfect. Unconditional acceptance means I acknowledge the reality of it. And actually, by accepting it, I may actually want to do a better job of changing that reality if I can, or change the way that I'm thinking about it. Hold whatever goals or standards you want. We're not challenging those. We would be saying, actually, if you accept yourself, you probably have a better predisposition to actually get it done. If you're putting yourself down all the time, you lack unconditional self-acceptance, then maybe that would inhibit the attainment of your high standards or your preferred goals that you would like, goals in life. So hope that's, again, hope that's helpful. Here's another excellent question. These are great. Why do clients often return to demandingness after appearing to understand preference language? What this individual, it's a great question. And what this individual knows about REBT is we have this kind of ideal vocabulary of emotions, etc., and cognitions or thoughts. And so the dysfunctional cognitions would be that demandingness, awfulizing, believing that something is 100% bad, as it could be frustration, intolerance, this is too much, I can't stand it. And then global negative rating of self, others, life, the world, especially global negative rating of the self and others can really get in the way of all kinds of positive or helpful emotions. So the alternative to those dysfunctional beliefs, the ones that I just mentioned, is instead of demandingness, we would like preferential language. I want, I hope, I desire. And this person is saying, why after going through REBT and we dispute demandingness and they learn how to do that and replace it with more preferential language? And the reason why we do that is if we have a demand that somebody be the way that we want them to be, for example, and they're not that way, then we set the stage for us to be disturbed about it. Whereas if we hope, desire that they're a particular way, then We may not be happy, we may be disappointed or annoyed, but not really highly dysfunctional toward them in terms of our emotional state. And so we would try to help the client embrace more preferential language. A lot of people think that preferential language means we're weakening it. No, we want you to have strong preferences and maybe lobby to reach those preferences, make those preferences reality if you can. But this one is why, after someone learns that, a client learns that preferences may be more helpful in the long run than demandingness, would they return to preferential language? Well, one thing is, when we learn REBT, we need to use it over and over again in different contexts, etc., so it becomes more habitual. If we don't practice it or apply it, then it's easy to go back to more demandingness, because we may have habits of demandingness and have not developed a habit for embracing more preferential language. Excuse me. Another question. How do you distinguish healthy guilt from unhealthy guilt in actual clinical practice? Another good question. One is, I and many other REBT therapists prefer different words for things, because it's so easy if we say healthy guilt, unhealthy guilt, for someone who is embraced really unhealthy guilt that's really messing up life in many ways, for them to think that their guilt is healthy. And so in REBT, we may use a different word for it. And so that kind of confusion doesn't happen. So what they're calling healthy guilt in REBT would probably call that more remorse rather than healthy guilt. So we would say guilt may be the dysfunctional emotion and remorse the more functional one. And they're related in this way. Both kinds, guilt and remorse, both begin with I have done something that violates a moral or ethical rule that is important to me. Then the differences kick in. With guilt, we go, and therefore I'm immoral, I'm unethical, I'm no good. So that's a real unhealthy, negative evaluation of the self, global in a sense. Whereas a remorse would say, I did something that violated it. Doesn't mean that I'm absolutely immoral, doesn't mean that I'm evil or not good at all. It means that I'm a fallible human being. I made some mistakes, and it's probably in my best interest to find out why I did that and try to do better the next time. So you see, it's not so globally rating on the individual, and opens the door for the person to make change. If you just beat yourself up, then you can feel really down. And sometimes people act out in unhealthy ways when they feel guilty. They may resort to drinking or all kinds of drugs, just to get that feeling away. Excuse me. Can someone have a rational belief and still experience significant emotional pain? Absolutely. Rational beliefs and irrational or unhelpful beliefs, I distinguish in this way. Rational or helpful beliefs really are beliefs that help us reach our desired life goals. They may involve some emotional pain, typically not as deep, but sometimes there will be some emotional pain. It's holding rational beliefs or helpful beliefs doesn't mean you're going to be happy. Doesn't quite make sense. Something really negative has happened, and we think we're going to be happy. That just doesn't, it's not realistic. Whereas if something negative happens and I hold a helpful belief or rational belief about it, then I can get over it better. I'm better able to attain desired life goals. Whereas if I have unhelpful negative belief, then it may get in the way of me attaining desired life goals. So one of the homework assignments for changing those beliefs is understanding the difference between those kinds of beliefs, right? So we can, even if we hold rational beliefs, experience emotional pain. Let me give an example. Let's say we've experienced the death of a loved one, and we are feeling deep sadness about that and grief. It's normal. There's nothing wrong with that. But so it could be normal. We could have rational beliefs about it, helpful beliefs, but we're still feeling the emotional pain. Whereas if we held more irrational beliefs, then rather than having grief, we may slip into major depression or something like that, which is much more serious and more challenging. So do not assume that if one holds rational, helpful beliefs, that they are necessarily going to be free from emotional pain. That's just not what we humans are like. But that can be a problem because some people believe that our goal should always be to experience a positive emotion. Let me give an example why a positive emotion in a situation might actually be dysfunctional. Let's say I'm a parent and I have a child that has a really high fever and I experience happiness. That would be highly dysfunctional. You wouldn't maybe take steps to actually get that fever down. Now, on the other hand, we may not want them to experience deep anxiety because they'd be so caught up in themselves and their thoughts about how awful this is, they may not be able to take helpful action. But a helpful negative belief might be more helpful because it would lead to an emotion like concern. We want a parent who has a child that has a high fever to be concerned, not highly anxious, but certainly not happiness. So happiness is a positive emotion. We like it, but it's not appropriate in certain situations. Here, what homework assignments have you found most effective for changing beliefs rather than simply increasing insight? Insight is good. We want clients to have insight, but having insight alone often doesn't make a change. It may set the stage for that, but it is not directly going to cause a change. So, for example, let's say I'm diabetic and I have insight that I probably need to take medications so that my blood glucose or sugar goes way up because that could potentially, in the long term, cause blindness and loss of limbs, things like that, or kidney damage, and earlier death, cardiovascular problems, all kinds of things. And so we want you to have insight into that, but insight is not enough. One would be maybe whatever your physician says. Maybe they say, change your diet or take a medication or insulin or whatever it is, live a healthier life, try to lower stress, some of those kinds of things. So insight's good, but insight alone often is not enough. Oh, here's an excellent question. When would you not challenge an irrational belief immediately? I know because some of my students, when they at the level of an internship or something like that, often think that once they identify the ABC, that they need to begin to challenge the belief. I think I learned from rhetorical theory that the idea of logos, ethos, and pathos. What's the message? What's the style of saying it? And do we come across as credible? But there's another aspect to this that is really important even in psychotherapy, and that is what is often called kairos, the timing of an intervention. So, for example, let's say I had a 2-year-old child. I'm at a pool party and the 2-year-old gets the gate open or it's left open, and unfortunately the child drowns. And let's say the mom and dad come in because they are deeply depressed and jobs are not going well, things in the house are not getting done, all kinds of things. And let's say they go, this is just awful. I can't believe this is happening. If we went and began to dispute whether that event was awful, that is not wise. That would definitely not be timed well. And so it would be often seen as a lack of empathy, and the clients may go, I can't deal with you, and they want to go to a different therapist. And it would make sense if someone said that to me, I would go to a different therapist. It's insensitive. And so there, we probably wouldn't begin with challenging the awfulizing. Maybe we could look at frustration intolerance or something like that. But you see what I mean about the timing of it matters. So you can't lose that connection to other people and appropriateness and sensitivity as a therapist. We're not mechanical, and REBT is not, okay, once they say awfulizing, then we must go after it right now. No, do what's more appropriate in the long run. Let's see. How do you know whether you're arguing with a client instead of helping the client dispute themselves? This is really interesting. And it happens to all of us who are therapists at times, I think. The difference when I know that I'm arguing is often by what's going on in my head. If I think this client they need to change this dysfunctional belief, right? This unhelpful belief, because it's causing emotional and behavioral disturbance. If they don't do it, this is going to be awful. Well, and so we may feel pressured to get them on the right track, and it comes across as demanding. That's not helpful. And we're modeling demandingness rather than moving to more preferential. Again, strong preference, really strong preference, but not that demandingness. So I'm always checking myself whether when I talk to them, even if I'm like, whoa, we need to move on this, or if we can, but realize that sometimes there's pacing to this, and that if I'm pushy or I'm arguing, then it's most likely because I'm holding an unhelpful belief. And so I just can quickly shift over to a more helpful one. How would you explain the relationship between inferences and evaluations to a graduate student? I would say when we look at the issue of cognitions in REBT, there are different kinds of cognitions. Two that are really important are inferences and beliefs. Inferences are those cognitions or those thoughts that attribute meaning to a situation, okay, or an event. We could call that an interpretation of that event. Whereas beliefs are not attributing meaning, they're actually evaluating the situation. So an inference might be, if I get an F on my exam, that would be a threat to my GPA, to whether I graduate with honors or even graduate. If I get too many of those, that's an inference. That's the meaning that I'm giving to getting an F on an exam. The belief would be the evaluation. That would be terrible. That would be horrible. I couldn't stand that. That's too much. So those are beliefs. Those are evaluations rather than an attribution of meaning. So I often will just do that. One, an inference is giving meaning to a situation. Belief is an evaluation of that situation. Why do clients often defend beliefs that clearly make them miserable? Well, there are all kinds of reasons for that, and I'm sure that you will think of some that I won't think of right now. One, they may have held that belief for a long time. It's entrenched. It's habitual. That when it's kind of like Pavlov's bell and dog, right? We see a situation, that belief is kicked in, and then boom, we act in particular ways. Sometimes we don't know an alternative. That may take a little while in therapy, usually not too long in REBT, but or they fuse with the belief. They somehow identify with that belief. And they may think that if they change that belief, or that we suggest that we change that belief so that they better attain their life goals, that we're actually attacking them rather than addressing a more dysfunctional belief. And I think that's why we orient a client to the beginning about how we will do it and what we'll do in the ABC model. Now, I often will say, sometimes if you say something really important, I may just interrupt real quickly. It's because I'm really excited about what you said, and I want to dig in to get some meaning, find out what you're intending to convey, so that I can better help. So if they fused with it and that becomes their identity, that can be kind of problematical. And so we can be a bit more gentle so we don't come across as, when we're changing a belief or trying to help them change a belief, that we're somehow attacking them or saying that they're inadequate or they're just not a rational human being. We don't mean that at all, but sometimes we may come across that way. How would you conceptualize emotional avoidance from an REBT perspective? I'm not fully sure here, but I think what this individual is saying is, in REBT, do we think that we should avoid emotions, right? Well, no. We think we should acknowledge those emotions, see them as a cue, be curious about them, because if we have those emotions, then that can be really helpful once we know what they are, because then we could go, oh, that's probably based on this kind of a belief or the meaning that I'm giving to something. So if I work on that, then that emotion may not come across so painful to me. And the other one is, avoidance is going to be really common for humans, right? Especially with anxiety. But some people believe that having the emotion is intolerable. So they have frustration intolerance about an emotion. So we would treat that like anything else that somebody has frustration intolerance about. For me, maybe the temperature. I have frustration intolerance about how hot it is right now where I'm living or whatever. I can have frustration intolerance about my emotions and disturb myself about a natural, normal emotion. These are all really good questions. There are a few more. Let me see if I can do it. Oh, these are, again, excellent ones. Can someone completely eliminate irrational beliefs? Well, I suppose hypothetically they could. But realistically and pragmatically, probably not. Why? I think REBT, at least as a model, and I know Albert Ellis thought this, was that we're fallible human beings doing the best we can, and we make mistakes sometimes. And it's not terrible. It's not horrible. That's what it means to be a human. So in DBT, they talk about wise mind, and it's wise mind as opposed to this rational mind or emotional mind. Emotional mind, we're driven by our emotions, right? Rational mind, we're driven by rationality. There's a downside to both. If we're driven by emotions, then sometimes that can lead to chaos. If we're driven by rationality and just ignore emotional content or emotionality, then we can come across as cold and aloof. And so they say, try to be as rational as we can, but acknowledge the emotional side and have a balance between those. A rational mind, if you've seen Star Trek, might be Spock. Spock's interesting. I don't know if I want to go out and have a cup of coffee with him to relax. On the other hand, if someone is just driven by an emotional mind, I'm like, oh, I just feel like I need to rest when I get home. But wise mind, there's a balance. REBT, we would say, probably not going to end up Spock and just driven by rational mind and never have an irrational or unhelpful belief. But when we do, we can help challenge and move on. Another one is unconditional self-acceptance actually attainable, or is it better viewed as an ideal that we continually practice? Excellent question. Again, I think hypothetically, I guess it would be possible, but realistically or pragmatically, probably not. There are times, particularly if we think of roles that we have in our life, and those roles are really important. And when we make a mistake in that role, we're more likely to globally evaluate ourselves if that role is really important. So, for example, I'm a father, so probably one of my most important roles. If I make a mistake in that role, then I might be more likely to globally rate myself. Another role might be the cook on Friday night at the house. That's a role. But you know what? If I burn the bread for my spaghetti dinners, my Italian bread, I'm probably not going to globally rate myself. I'll just say, hey, we're going out to eat tonight. or something like that. So we do have to be careful for roles that are really important to us, that there's a greater likelihood that if we make a mistake in that role that we'll globally rate ourselves. And all of us have roles that are really important to us. And is it helpful to globally rate ourselves there? No, but it's perfectly human that happens. So probably not a great idea to beat up on yourself for doing that. But go back into the role and say, what could I have done better in that particular role? Maybe there was nothing I could have done better. Okay. Oh, here, I love this one. How compatible is acceptance and commitment therapy with REBT? Where do they agree and where do they fundamentally disagree? That is a whole half-day lecture, I think, on that one. But let me just say that I'm thinking of Albert Ellis, and he wrote a textbook with Catherine McLaren. And at the very end of that book, I'm horrible with titles of books, and it's an excellent book. I think it's the only one that he co-authored with Catherine McLaren, so you could do Google search on that. But REBT and, of course, CBT are second wave behavioral models, whereas DBT and acceptance and commitment therapy are more third wave. Often very globally and with broad brushstrokes, we will say that the third wave is more acceptance-based, and the second wave would be more challenging of the unhelpful beliefs. So in acceptance and commitment therapy, they may have the client sit with, rather than avoid, the dysfunctional emotion. And REBT, we might challenge dysfunctional belief. In REBT, we'd be likely to challenge the unhelpful belief. Not always, but we would eventually want that to happen. And so, but we would not, in REBT, they would not say that we should run away from an emotion. We would go sit with that emotion, but because it may take a while for us to challenge an emotion and for you to learn how to do that. And if you run away from it, you're not going to be able to challenge it and do a cognitive restructuring. So we would agree on that. It'd be a different emphasis. One area where it's a little bit different, that my first doctorate was in philosophy. So I'm always been interested in the nature of the self. In acceptance and commitment therapy, there are three kinds of self, not different kinds of definitions, etc. And it's very helpful. I don't have time to go through those, but I find it very helpful to look at that. Whereas if you go over to REBT, not a whole lot of time is spent talking about the nature of the self. I don't know of anywhere where there's a deep philosophical discussion about it. It doesn't mean that we don't discuss the nature of the self. But we also believe, and we've already talked about it, unconditional self-acceptance. And so I remember saying to Albert Ellis, I said, Al, what are we accepting when we have unconditional self-acceptance? We have no theory of the self. And we laughed and it was like, well, it is whatever you view as the self, whatever it is, accept that, right? Rather than put it down or aggrandize it. Either way is dysfunctional. So they just don't dive into that. Again, I do, because that's what a philosopher does. And so that's a difference of approach. I don't think that the outcome is much different when we do that, but there are some differences in the two, but a lot of overlapping. This one, maybe someone knew that the area that I work on the most is on addictions and trauma. I do research in those areas. I have classes on them, train mental health practitioners on how to treat addiction and trauma. And it says, the question here is, when treating PTSD, post-traumatic stress disorder, which should be targeted first, the trauma memory or the irrational evaluation surrounding it? Excellent question. And if you go to the American Psychological Association Division 12, that looks at evidence-based kinds of psychotherapies, it will say about PTSD, they don't list it this way, but when we talk about the models, we say there are two types of models in treating PTSD. There's one is present-centered treatment, and the other one is just more moving into the treatment of it. So they would exposure-based models. They would have the client imaginatively expose themselves to the traumatic event or the event that they experience as traumatic. In present-centered therapy, exposure is not used at all. Instead, they would help the individual deal with those symptoms as they arise and have some coping mechanisms, some tools, etc. So, for example, just to contrast the two types, one present-centered model that is excellent for treating both trauma and addictions is Seeking Safety, is developed by Lisa Najavitz. Excellent. And it's usually done in group. It can be done individually, but even in group, they don't have the clients talk about the trauma. They will talk about their responses to trauma, helpful and unhelpful. But in prolonged, one of the exposure-based one is prolonged exposure. That is repeated imaginative exposure to the traumatic event and then overcome them. They both have excellent outcomes. Some research has suggested that the dropout rate for some of the exposure models can be higher, right? Because you can imagine that exposure may involve some emotional pain, maybe a bit more than non-exposure present-centered models. Both have good outcomes, and so we make a decision. Well, what about our REBT? I often see as bridging the two. They most likely don't begin with the exposure to the trauma. They might begin with the exposure to the thoughts that they may have about the trauma or deal with the emotions that arise with that, but not go to the trauma memory first. Some REBT therapists may do more exposure, right? So it's not absolutely clear how that there is an REBT way to deal with this. A few more of these. These are, again, I'm so impressed with the questions that people email me. I'm just thank you all so much for taking this seriously. This one's more philosophical. Can morality exist without demandingness? It can exist without demandingness, and morality can be values-based. And you could hold a value, but you could hold the value as a regulative ideal, something to shoot for, right? Something to move toward, to guide preferences and actions and all of those kinds of things. But you can do that without demands. Although in REBT, there are sometimes legal demands. In REBT, we don't dig into moral demands or legal demands. We dig into more global, what I would call metaphysical demands, that reality has to be the way I want it. That's one thing. This person absolutely should not have done that. Well, we don't know what's causing people to do things in the first place. So how can we say it? Doesn't make much sense. But on the other hand, if we say to be a moral person, then you probably should not kill an innocent person. REBT is not going to mess with that. Hold that moral stance, we're fine. Another one might be legal. If you want to be within the law, then drive 25 miles an hour in a 25 mile an hour zone. Don't drive 50 miles an hour, whatever. So we don't go after those, right? Those are not absolute. Why? Because we can put them in if-then form. If you want to be moral, then. If you want to be legal, then. Absolute ones, there's no if format in which you can put it, right? So it's just absolute. The world has to be the way that I want it to be. So yes, you can be moral without being demanding, but sometimes morality can take the form of having demands within it. Oh, here another one, really good. Can someone simultaneously practice radical acceptance and strive for change? Absolutely. You could radically accept in the sense of acknowledge this is the way that it is. Now, if you mean by radical acceptance that you say we just absolutely have to accept everything and not want change, well, of course not. But radical acceptance, and if I acknowledge that this is the way the world is, and this is the way my life is right now, would that get in the way of striving for change? Absolutely not. In fact, we have found, study after study, we find that if we radically accept situations, right, our events, situations, we're more likely to strive for something and do a better job when we are striving. It's really interesting. If we look at some research, we find that when we strive for short-term goals, that the striving raises our dopamine levels. And then when we raise our dopamine levels, that increases motivation. So striving for a goal actually raises the dopamine levels in the body more than the attainment of the goal. So it's really important to strive so we can continue to attain those short-term goals and move toward the long-term goals that we want in life. And some of those long-term goals we will never attain, but when we strive for them, we build the self that we want and contribute to the world that we want and the relationships that we want. Is happiness actually the goal of REBT? We don't define, for Aristotle, the ultimate goal is happiness, right? And so that is not the case within REBT. We listen to what the goals of the client are, and we help them shape those goals. So, for example, if your goal is to be happy under all conditions, probably not attainable, realistic goal. But if they say, I want to move toward more happiness in my life, and by happiness, this and this, so that it becomes instantiated, then we can help them. So we are more about helping them attain their goals rather than having this big external goal that we think everybody should or ought to attain. Now, some of their goals, I may decide I don't want to work with that, right? If I have somebody that, for example, is a serial killer and they don't want to experience any remorse, I'm not working with that. So, because I wouldn't be effective for that person. I just probably couldn't work with them. So I have to think about that. But generally, I don't think I've ever had a case like that. So it's never come up. I'm always able to work and negotiate with the client, the better attainment of goals. There's a couple of more, and then we'll call it a day. How would you explain the default mode network using REBT language? Oh boy. If you haven't heard of the default mode network, it's one of the systems within the brain that's tandem with the test positive network. Default mode network is that network of the brain that is activated when we are not attending to a task. We're not focusing on something. I call it the elevator music of the brain. It's when we veg out, etc. Whereas task positive is when you're taking that REBT exam, you're really focused. You don't want to mess it up and fail it. So that's the task positive. When the task positive mode kicks in, then the default mode is not activated and vice versa. And we want it that way. One of the examples is when I'm driving to the university. I've driven to that university so many times. And I'm sure all of you have had this kind of experience. I know where I'm going, but I'm not attending to what's going on around me so much. I may be thinking about something, not to the point that I'm driving off the road or anything, because I'm kind of muscle memory here. And so, however, if a car starts coming toward me, then I would be in default mode when I'm vegging out driving, but I'd switch over quickly to task positive mode of that car, because now I want to divert getting hit and that kind of thing. So it goes back and forth and back and forth. In some conditions, there's overactivation of the default mode. We see this in anxiety, in depression, addiction, and all kinds of conditions, right? So in REBT language, I would go, what does the default mode really do? Well, the default mode also creates your autobiographical memory. the story that you have about yourself. And that story that you tell about yourself is not necessarily the true story, because the default mode pulls from different experiences that aren't even connected and creates a story. And so often, if we listen to that story, we will hear a story filled with self-condemnation or hugely negative events or trauma-filled memory, etc. So by helping them change that and having them do the behavioral exercises where they're acting into the world based upon more helpful beliefs, we are helping them change the autobiographical memory within the default mode. So they're connected in that way. So what a great question. And then the last one is, how might evolutionary psychology explain why irrational beliefs are so persistent? Excellent question. And so if we look evolutionarily, the brain has one primary function, and that is to keep us alive. Not to make us happy, but to keep us alive. And so because the brain wants to keep us alive, it's biased toward the perception of two general things: threats and resources. And so because it is biased towards threats and resources, then we will see threat that isn't even there, right? It'll interpret something as a threat that isn't really a threat. So for example, social phobia or social anxiety, get up and give a speech. There's no huge threat. You're not going to die. But the brain is biased towards seeing threat, so it may interpret that as a threat. So what's the result? Increased anxiety over time. And so that increased anxiety over time in social situations like that may be dysfunctional. And so also one of the biggest protective factors that we have from an evolutionary standpoint is our connection with other humans and maybe even animals, etc. But if we've just focused on humans now. So because of that, we may see disconnection as a threat. So we're in a love relationship, we break up from an evolutionary standpoint, then we've just increased potential threat in the environment. Let me give an example of an experiment that shows this. The research study had two different groups that were looking at a picture of a mountain, the same picture for both groups. And they asked the individuals in both groups to estimate how tall that mountain was and how steep that mountain was. Two things. One group had two people in it, a person, and I think it was a friend, maybe. And the other one they were just individual. No other person was with them. Fascinating. Same picture, same mountain. If there were two people in it, they saw the mountain as not as high and not as steep. If you were alone, you saw the mountain as higher and steeper. So what does it? Well, because connection is so important, that when we're connected, it lowers the perception of threat. And so knowing this, often in REBT, when I have people who are isolating or highly anxious and highly avoidant, then I will help try to restructure some beliefs and focus some of them on connection. Loneliness is another issue. Loneliness has been described by the CDC a while back as the biggest emotional problem that we have, health risk that we have in the United States, and came up with different models for how to help it. One was if we gave them advice to go connect in a group. The one was get social skills training, and the third one to change your about connecting with other people. They found that the one that had the least impact was just recommending to someone that they go into a group. The next one was social skills training, because social skills training, but they found that most people who are experiencing loneliness don't need social skills training. They know how to connect, but was about changing cognitions, so that if changing the cognition, seeing with another person as valuable and moving them toward them, things got better and the loneliness went down. So I think evolutionary theory and neuropsych can help us in our practice of REBT and have a deeper understanding of why some of our interventions are really, really helpful. So I want to thank all of you so much for doing this. If you enjoyed this, please reach out and ask and email me some other questions, or when you watch this, ask some other questions that you might want me to answer. Or if there are areas that you disagreed in, that's fine. Then I can go digging and do a little more research on each of these. But I do thank you all for that and look forward to hearing from you. And if you haven't joined channel Psychotherapy Education and Training, feel free. There are some benefits for doing that. All the best and have a great day.